Hello everyone, and thank you very much for the opportunity to present. It's a thrill and an honour to be here today, and always nerve-wracking following Derek, who is the consummate professional and incredibly accomplished in the space of digital health. So I've had the projects. He's very nice to some of the things I'll be talking about today. But one of the first questions a lot of people ask is, why psychology? What is psychology doing in the digital health space? Why or how does it fit in? Well, of course, as you've heard over the last few days, and indeed in the case of the two talks already today, we are all aware we're living in the age of a digital revolution. That 5 billion people are using the internet globally. That is a very difficult number to get your head around. And as Derek pointed out, COVID was the best accelerator for some of the fantastic ideas around how we can deploy digital health innovation to solve clinical and public health problems. And as we also heard, and on the first day you would have heard from lots of industries, especially in Ireland, there are some fantastic industries working in the space, medtech, connected health, and they are driving a lot of the innovation. And initially, a lot of the innovation that was coming from industry was developing a solution without understanding the problem. But that is a game that is changing. And particularly when we looked at very real problems we needed to solve during the pandemic, industry became really focused on more specific ways to use what it was creating. Now, you've heard about all the different trends in technology and health, but I'm just going to remind you, I'm a psychologist, and I had to learn words and concepts that is something we never learned in college, and you had to go to grasp how these different technologies fit in the world, and then think about how you can use them to solve problems in your research or in the teams you're working with that are looking at clinical health unmet needs. So most of us here are probably wearing some kind of wearable device. Anybody wearing watches or carrying gizmos and gadgets? Yes, increasingly, and then apps on our phones that are tracking us. So we've heard about lots of ways. And of course, all of that is leading to something really important we've heard a lot about. And the future of a lot of these tech companies is the idea of data. We hear about the term big data, which is data from a variety of sources that when you bring it together and analyze it can tell you a lot about a person or people. We're much more predictable than we realize. And of course, this then feeds into artificial intelligence, which Derek was just about to get into the meat of it, because the possibilities for the use of this are really quite amazing. And some of those projects are ones that Derek is leading on now as well, to look at ways we can harness the data and create the algorithms and drive artificial intelligence. So most of us are aware of artificial intelligence from chatbots. You know, that would be probably as far as most of us would get. But actually, the use of social robots, as some of the projects Derek outlined, where you can use artificial intelligence to have an intelligent interaction with another being. And we've started a project led by Derek on the use of virtual humans. He showed you Morgan Freeman. Whether or not you can create a digital human that is acceptable to people in terms of giving medical advice that responds in an intelligent way to your queries and questions, and gives you a personalised interaction with potentially a medical professional. Now, virtual reality is something that's been around a long time. A lot of us are familiar with it. But actually, there's some very good evidence that it's very effective in treatment of things like post-traumatic stress disorder or pain with patients. And so there's a lot of work ongoing into ways that we can harness that for health. And Eric alluded to 5G. And I have a brother that works in Ericsson's. They're already talking about 6G, so we haven't even got 5G. And this opens up loads more possibilities for what we can do in terms of harnessing digital innovation for health. Things like robotic surgeries remotely, because you've got 100 times the speed that you have with 4G. Augmented reality glasses, a few people are using the swim goggles form, counting things in front of your eyes, and how you can impress data on your reality that will enhance your delivery of healthcare. And of course, remote monitoring, some of the projects that we heard about earlier, which allows us to provide care just as good as seeing someone in the flesh. But this is where we come in. Ordinary people are like, are you joking me? a robot, I want to see the doctor, I want to talk about some private things, I'm not talking to a robot. We heard a lot about the scandal with Facebook and abusive data, and a lot of us are very cautious now. You know, we're really concerned that, you know, we know what Siri in our phone is doing. We're thinking like, why is it, you know, trying to sell me nappies? You know, what did I say? You know, why am I being advertised to in this way? We don't like the idea we're predictable or that we're being brainwashed. We're really worried patients are that they won't get to see the doctor anymore. Remote monitoring sounds fancy, but does that mean I can't go in and just have a chat? And I'm worried about things, and I'd like my concerns addressed. And patients aren't the only ones. From the use of the robot that Derek showed earlier, a couple of the nurses were like, oh, you know, am I going to be out of a job? Or is that guy looking at me? Do you think that robot is watching us? You know, so there's a lot of concerns. And these need to be addressed if you want to see technology implemented successfully in the healthcare setting. Now, we heard earlier from the European Commission, and of course, you know, digital health's been around quite a long time now, and the European Commission and the World Health Organization have recognised its potential, and they understand that it can transform the way we deliver healthcare. But what it has recognised is the concerns from the people who deliver and receive healthcare. And it said for it to work, we need a person-centric digital health solutions. And so if we want safe and effective transformation of healthcare using these digital health innovations, we need a multidisciplinary approach. There's no one individual or discipline that has all the answers in this space. They simply cannot do it. So who are the stakeholders and how do you bring them together? And we heard from our keynote earlier that that's very, very challenging because people have different desires and goals and wants. And how do you get people focused on the same thing? And of course, so that meaningful stake, but of course I'm going to say psychology is a key pivotal component of this exercise. Why is psychology so important? So I've been working in this area for about 10 years now, and a lot of listening and learning has to occur before you can actually think about what has my discipline got that's useful to these problems. And of course, the pandemic helped us a lot as well because there was such a focus on people's emotional response to things, what people did as being central to how well they recovered or their health outcomes. So if people find something unacceptable, they won't engage, they won't use it. You can have a fantastic app, you can have fantastic wearables, they're like, I don't like the colour, it makes my skin scratchy, you know, it ruins my clothes, you know, so I'm not going to wear it. So how do you develop something that people find acceptable or even attractive that they will engage with, and how do you promote ongoing engagement with it? How do you design it so that it's efficacious? And one of the things we see is that what the tech companies often have is bells and whistles, really fancy dashboards, sliding screens. What the people at the other end want is something with a yes, no, something very simple and easy to use. Often the best solutions are really, really simple. And a big area of health psychology that we were doing long before harnessing digital health was behaviour change. Everything we do has a direct effect on our health, whether it's what we eat, how we sleep, whether we take our medication, these are all behaviours. So often you're targeting specific behaviours, they're personalised to individuals, and that personalisation is really important. So technology actually provides a fantastic platform to target behaviours that people need to engage in, whether it's taking your insulin or, you know, getting your step count, whatever it is. And how can we work with technologists and medics to create optimum solutions? Because we know what people are like. We are people, you know. And if you try to get people to change too many things at one time, they'll just go the other way. They'll explode. They say, I'm not having it. So, you know, if you've got a guy who says, I'm willing to run, but I'm keeping them ciggies, you think, well, that's a small win. Let's just start from where we are. So often you need to select the behaviour that's a high priority or that a person is willing to go with you on, and you start from there. Now, we see things not working repeatedly. And, you know, doctors, you'll hear them say they're not listening. If they just do what I tell them, everything would be fine. Where's that gap coming from? And Desmond Tutu put it beautifully. There comes a point where we need to stop pulling people out of the river. Some of us need to go back upstream and find out why they're falling in. So prevention, if you understand people, their motivations, habits, self-regulation, if you understand those things, you have a better chance of getting successful outcomes with any type of intervention, not just a digital one. Derek's already explained all this, so I was just able to give the correct answer, like the good school child down the bottom here. Can you use robots to improve patient knowledge? Well, this project was using Pepper, or Dave the robot, to deploy educational content to patients in the waiting room of the diabetes clinic to save Derek and the other staff time. And you might think, well, they're like, no, I really don't want to talk to the robot, but they knew that they were going to see the doctor. So they engaged with it, and there was a test of whether or not their knowledge increased. And it was just as effective as having a nurse or other explain to them. That's not taking a nurse's job or a doctor's job. That's allowing them time to operate at a higher level and save resources that are really under pressure. The other thing as well that was a pleasant finding is that actually the patients found the novelty of Dave the robot really good, and they enjoyed the interaction. They didn't feel threatened by it. And one of the reasons this and other projects have worked so well is we had key people on the panel, PPI we call it, public or patient involvement, advising on strategies or structures that would or wouldn't work. But the holy grail is behaviour change. And Derek told you already that Dave the robot in the foyer, now he was a little bit manipulative, he left that bit out. If he said, would you like to wash your hands today? And somebody said, no, he went, So that really bumped up the compliance there. So a little bit of emotional blackmail from Dave. And also the Clare Island project, which is a hugely ambitious and challenging project, which is going to an island that has nothing. And no phone signal, no technology, a small group of inhabitants. Initially, the first meetings were a little bit challenging because when Derek and co arrived in a suit, they all fled and hid in their basements because they thought he was a taxman. So first piece of information, dress, maybe not in a suit. So very fortunate to work with a multidisciplinary talented team on this challenging project. Derek says, join, it's going to be really, really glamorous. And then we went on a boat in a storm across to the island to do some very important work. So none of us had good hair when we arrived over there. To do something really important, which was to talk to the locals. We have these public meetings, stakeholder engagement sessions, which really created a sea change in mindset from we're not going to engage to, do you know what, we're really glad you've consulted, we like to give some input, and we can see on balance this is going to be very useful for us and our health. So last couple of slides, we work across a lot of different dimensions in technology and health. And I, for one, have adapted to where the needs are in any project. Sometimes it's around engagement and understanding fears and motivations and harnessing them then to build interventions that are most likely to get engagement and also bring about behaviour change. And we have a full science of behaviour change in psychology we use. I'm not going into the details, but it really allows for very effective interventions to bring about the desired changes that will improve people's health and well-being. So I just came back yesterday from Africa, where I was for 2 weeks, working on a Horizon Europe €8 million project, which is looking at trying to improve adherence and acceptability of testing and treatment for malaria in Ethiopia and Madagascar. This project is led by the Louis Pasteur Institute in Paris and also the London School of Tropical Medicine, and is very, very challenging with partners globally. What we're trying to do is develop acceptability, understand why certain types of testing and treatments are not acceptable. And specifically, the Galway unit are leading a work package on the development of a digital health device or system that is going to be used by service providers to track, trace, and follow up with their patients. So it's a very, very complex project. We're in the first 6 months. It's a global partnership. As you can see the whole way, we're very, very, very proud of our little Irish dot there in such a magnificent consortium. And you can see we've got people down in Australia as well as 2 African sites as well. Our main role is to go down, which is what we've just been doing, to the sites, meet the stakeholders across lots of disciplines, from the key workers in the healthcare right up to the policymakers, the researchers, everyone. So we've just conducted workshops in both sites. We are then going to use all this knowledge to guide the development of a digital health tool that will be used to capture data and aid decision making. And then we're also going to write a digital health strategy. We've never written one of those before, so I'm really going to enjoy that challenge, which is incorporating all the learning across the project as well as our own science to try to address this really challenging area. So there's just the group we met in Ethiopia. We're standing out there as the ones who you just come from Irish winter, or maybe we're still in it, I'm not sure. We got a great response from both sides. We had to do a lot of French in this workshop, Madagascar, back to Leaving Cert French. And we had some fantastic translators help us with some of the rural stakeholders. So really enjoyable, fruitful experience. We've got really high quality data. And the quality of the input we got from people was astounding in terms of solutions. We asked them about barriers and potential solutions. So the method we used for your information is called collective intelligence. So when we heard our keynote earlier saying, how do we get the best brains working together? That's a methodology we've used in several European projects, and it's very, very effective. And if you want to know more about it, just drop me an email. There's our group's slaving. So what about the future? Everyone's trying to predict the future. None of us really knows, but we have a stab at it anyway. It's about merging the stakeholder input from the beginning, the bottom up, as well as the top down information you have. It's really important that we consider the issues around regulation, privacy, and people's concerns. And then the synergy between several disciplines. But most of all, in the words of the African proverb, if you want to go fast, go alone. If you want to go far, go together. Thank you very much.